How are we doing in this town when it comes to addressing people who need some help, something as simple as prescription medication? And Kwanzaa, I'll let you start with that.
You know, I think the closure of Peachtree and Pine and the wraparound services that people have begun to roll out are great, but really we're not doing a good job. And I have to be honest about it. We need a collaborative partnership with the county, because that's where most of the human service dollars flow through. There's been disconnect between the top leaders in both organizations, as well as the state and the federal government. So we're gonna have to re-engage around mental illness. It's been 20 years or so since the funding was cut, and we've got to go back and start lobbying for it, as well as figure out local solutions, because if we don't deploy our resources there, we're going to continue to have these repeat situations, and sometimes they turn out to be violent, unfortunately.
Mary Norwood, in your view, the value of services such as that?
Well, we clearly have to address it, and we need to have housing for people who have those issues. So I am in full favor of supportive housing. I have always said I want supportive housing because then you are stable. That rapid residency is a really important part of the whole continuum of care that the Regional Commission on Homelessness is doing right now. If we can get you in supportive housing, if we can have wraparound services, and if we can make sure that that supportive housing is a good neighbor with perimeter security, so there is no spillage as there was always around Peachtree Pine, I would like to see that kind of initiative expanded.
Peter Amon.
Yes, so first I'd like to start at a higher level, which is in the city of Atlanta, we need to have a much broader and deeper conversation about mental health issues. Other cities do a much better job of addressing these issues than we do. You can go to other cities and you can see at bus stops, at train stations, the number for the suicide prevention hotline. You can see in workplaces flyers on where you can get access to mental health services. So at the highest level, we need to start there. Specific to some of our most at-risk populations, a few years ago I helped found a nonprofit that works with the homeless, Partners for Home. And what we try and do is make sure there's more access and coordinated access to mental health and other support services. So from the very top level to the detailed level on specific populations like homelessness, we have to do a lot more on this.
Yes, Keisha.
I've worked as a criminal defense attorney, a prosecutor, and I served as a judge. So I've seen this from every angle. And what we have to do more of in the city of Atlanta is what we did when I came in on city council and I looked at our panhandling legislation. I asked that we do a complete rewrite of that because really there's sometimes only one opportunity that we get people in front of us who are in need of services. So it's not just about enforcement, it's also about combining it with empathy. And you mentioned mental health services and medications. I've also seen people in court who were having diabetic incidents and didn't have their insulin and had committed crimes. So it really is about, once we get people in front of us through our court system, making sure that we are making available to them the services that they truly need to help stop crime.
Chairman Eves.
So to your question, Justin, it's a work in progress. 70% of the folks in the Fulton County Jail have some sort of mental illness. So what have I done? Number one, having established what's called a handoff strategy. So when the person leaves the Fulton County Jail, they go to some mental health provider for support, number one. Number two, under my watch, we made a decision to outsource mental health services to empower mental health providers in the community and hire a mental health navigator who will work not only with the ex-offender community, but the homeless community. So that will be going into action later this year. And then number three, it was a travesty when Peachtree and Pines was closed and there was no displacement plan in place for the homeless people to go. There's a missed opportunity for the city and the county to partner in terms of providing the wraparound services to those people who, when they were disallowed from being able to go into Peachtree and Pine.
Council President Mitchell.
Yes, I mean, you know, the real issue here is that mental health issues really is a thread that runs through so many things in our society and our community, whether it's our families, whether it's our workplace, whether it's what happens on our streets. I think the big missed opportunity here is that we've not partnered. As Chairman Eve said, we have not worked together. And we've looked at the solution for someone who's struggling with a mental illness is to put them in jail. If we're communicating better between Fulton County, this incredible infrastructure of nonprofits we have in our city, and the city of Atlanta, we can make sure that people who are suffering from a mental illness illness don't go to jail, but they go to services and they go immediately so that they can continue to get or start to get the services they need. But it really just boils down to partnership and not acting in silos. When I'm mayor, we're going to make sure we bring people together and not act in silos.
And Ms. Willard wants to finish this?
Sure
Yes?
thing. It takes a community to get this done right, and we haven't done it right for years. But it's really important to know that it's not just mental illness, but people with HIV and TB and diabetes and other things that need day-to-day control of their disease with medication need housing, because you simply can't stay in care if you don't have a place to be. Other cities have day labor programs where people can come to locations, or they'll get picked up by a van, they get to do work for the day and they get paid, but along the way they get asked questions and they get connected to services so they can get IDs, so they can get a shower, so they can find a home, other kinds of places. And so we need to have more regular contact with people who are on our streets who need services, and I think this is a great way to start.